the strategies that managed care organizations can use to manage hospital readmissions is to look at the types of patients that are getting readmitted, evaluate them, and what I think they'll find is many of these patients are patients who are approaching the end of their lives. They're going back and forth to the hospital because their chronic illnesses are increasing in severity and they're nearing end of life. And therefore, one of the strategies they can use is to invoke the use of hospice and palliative care services as a way of preventing the patient from coming back to the hospital when they're in the hospital, or even preempting that by trying to have them receive hospice and palliative care services at home through consultation in the home environment, so that they won't even go to the hospital in the first place. Well, end-of-life care in the United States is unique because in terms of hospice services, it's the one country in the world where we have a separate benefit that defines end-of-life care. The Medicare hospice benefit, and it's also used by Medicaid, many commercial carriers as well, so many of the managed care programs will fund hospice separately through a benefit. And so for those patients who are in the last several months of life, the cost of hospice is defined and controlled by a fixed daily rate under Medicare, in which the hospice agency then has to provide all the services to the patient for that single daily rate. And the same is true now of Medicaid and most managed care carriers who on the commercial side. So I think better utilization of hospice services earlier in the course of illness, I think, would be an excellent way of improving end-of-life care and saving costs to the entire system, because once the patients end up in hospice, for example, if they're on Medicare for the managed care company, the patients, it's a carve-out, so the patients are no longer the responsibility of the managed care organization as far as payment for services for the terminal illness concern. And for the others, it fixes the cost of services, either on the commercial side and on the Medicaid side, so that therefore they're also not on the hook for additional payments should the patient have complications.